Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Beta blockers in thyrotoxicosis. Now, what are the uses of beta blockers in thyrotoxicosis? We have advantages, we also have some limitations. So, if you see the advantages of using beta blockers in thyrotoxicosis, beta blockers will mainly they will inhibit or they will stop the adrenergic manifestations. They will decrease the adrenergic manifestations. Actually, in thyrotoxicosis there is increased number of beta receptors. Now, because of the increased number of beta receptors, the patient will manifest with the um, because of increased number of beta receptors, there will be increased sensitivity of receptors to the tissues, and thus the patient will manifest with all these adrenergic manifestations like sweating, tremors, tachycardia, palpitations, nervousness, and anxiety. The main work of these beta blockers is to block the beta receptors so that the patient will not have these adrenergic side effects. Second, what are the limitations or disadvantages of using beta blockers? So, the limitations of beta blockers are these beta blockers have not no significant effect on thyroid status. They only have one effect on thyroid status, that is, they can decrease or reduce the conversion of T4 to T3. They can reduce the conversion of T4 to T3 only to some extent, except that they do not have significant effect on thyroid status. And one more important thing is they do not correct the metabolic abnormalities also. They just correct the sympathetic system and thus decreases tremors, tachycardia, sweating, all of them, but they do not have any effect on metabolic abnormalities, and they do not have many effect on they does not have any effect they do not have any effect on oxygen consumption also. So, beta blockers should always be combined with other drugs because of this disadvantages.
thank you and thank you for watching.